Type 2 diabetes is often called a silent killer because its early warning signs can be incredibly subtle and easy to miss. Sometimes the symptoms it does cause are so unexpected that you'd never think to connect them to high blood sugar levels. In today's video, we'll first look at 3 classic symptoms of high blood sugar, and then we'll explore 10 lesser known or more unusual symptoms. Let's dive in. As always, this video is educational and does not constitute medical advice. First, it's important to understand that diabetes and high blood sugar exist on a spectrum. There is no clear line where problems suddenly develop. The optimal blood sugar range is 70 to 80 milligrams per deciliter during the day, and HbA1c should be below 5.5%. Once your blood sugar levels rise beyond this healthy range, you've entered the diabetes risk zone and opened the door to potential damage over time. Borderline high blood sugar and prediabetes, defined as fasting glucose levels of 125 mg DL, and HbA1c levels of 5.7, 6.4%, should not be taken lightly. The harm to your heart, blood vessels, and other organs is already underway, even without a full-blown diabetes diagnosis. Research shows that around 2/3 of emergency room heart attack patients already had prediabetes. So, if you've been diagnosed with prediabetes or metabolic syndrome, don't assume there's nothing to worry about until your blood sugar reaches the diabetic range. The reality is that the risk of heart attack and stroke rises with any blood sugar elevation beyond the normal range. Now, let's first look at 3 common symptoms of type 2 diabetes. 1. Increased thirst and frequent urination. One common, yet often overlooked, sign of high blood sugar is increased thirst and urination. When glucose levels in your bloodstream rise too high, your kidneys work overtime to flush out the excess sugar, leading to excessive urination, polyuria. This increased urination results in greater thirst, and frequent trips to the bathroom can leave you feeling dizzy or lightheaded. Avoid sugary drinks or fruit juices, as these will only worsen the problem by spiking your blood sugar further. While thirst and urination can be caused by various factors, if these symptoms are regular, it may be a sign of diabetes. 2. Constant hunger. Uncontrolled high blood sugar can cause insatiable hunger, known as polyphagia. When the body struggles to regulate blood sugar, levels tend to spike and crash, causing shakiness, hunger, and irritability. The hangries. This can lead to cravings for carbs or sugary foods, mistakenly believed to relieve the blood sugar crash. However, this perpetuates the cycle of fluctuations, further raising blood sugar levels over time. The best approach to stabilize blood sugar is to focus on low-carb foods and higher protein, healthy fats, which help eliminate the hangries and avoid glucose ups and downs. 3. Constant fatigue. Fluctuating blood sugar levels can wreak havoc on your energy. When your body isn't processing insulin properly or lacks sufficient insulin, sugar remains in your blood instead of entering your cells for energy, leaving you feeling fatigued and drained. Additionally, frequent urination that accompanies high blood sugar can lead to dehydration, further contributing to fatigue. Now, let's look at 10 less obvious or more unusual symptoms of diabetes. 10. Unexpected weight changes. Weight gain is a common symptom of diabetes, but not all people with the condition are overweight or obese. Unexplained weight loss can be one of the first signs of high blood sugar. Despite constant hunger and increased food intake, you may lose weight without trying because your body can't utilize glucose for energy and instead breaks down muscle and fat stores. 11. Irritability or depression. Sudden changes in blood sugar levels, common in diabetes, may contribute to mood changes. High sugar and starch intake can disrupt the gut microbiome, which produces serotonin, a brain chemical regulating mood. Post-meal blood sugar fluctuations can cause anxious and depressive moods, negatively impacting cognition, attention, and focus. 12. Tingling and numbness in hands or feet. High blood sugar levels can cause complications long before you're aware of having diabetes, including tingling and numbness in extremities. Numbness and tingling in hands or feet. One of the earliest signs of diabetes is mild nerve damage that can lead to numbness or tingling in the hands and feet. This occurs because excess glucose damages the small blood vessels that supply oxygen and nutrients to peripheral nerves. A common early symptom is a persistent pins and needles sensation in the extremities, indicating that nerve damage is already underway, even if your blood sugar levels are not yet in the diabetic range. This nerve damage is extremely serious and requires prompt attention, as it can progress to a complete loss of sensation. Without feeling in the hands and feet, you become more prone to injuries, slow healing, and infections, all of which raise the risk of eventual amputation if left unchecked. Sores that heal slowly. Uncontrolled blood sugar can significantly impair the body's ability to heal cuts, scrapes, bruises, and other wounds. Diabetes causes nerve damage and affects circulation, especially in the lower legs and feet, delaying the healing process due to insufficient blood flow to the area. Even minor wounds are more prone to infections in those with diabetes, which can become very serious and even result in amputations if left unchecked. You may notice drainage seeping onto your socks or an unpleasant smell if you develop a foot ulcer, which is a clear sign that the wound is not healing properly. Yeast or urinary tract infections. Higher than normal levels of sugar in the body can feed yeast infections like Candida and certain pathogenic bacteria. Candida organisms thrive on glucose, so the foods and drinks you consume may inadvertently encourage Candida overgrowth. Candida normally live in a person's digestive tract and vagina, but are typically kept in balance. However, an out-of-control Candida infection is usually an indicator that your body's immune system and possibly your blood sugar levels are out of balance. The excess glucose in the urine also provides a prime breeding ground for bacteria and yeast that would not normally survive. Recurrent urinary tract infections, combined with frequent or ongoing yeast infections, are a good reason to get checked out by a medical professional. Blurry vision. Even before high blood sugar levels start to damage the blood vessels in the eye, causing diabetic retinopathy, vision can become blurry in the early stages of diabetes or prediabetes. Elevated glucose levels can cause the blood to thicken and build up in the eye, temporarily changing its shape and making it harder to focus. This blurriness can be a chronic, ongoing issue, but it can also occur acutely after consuming a high-carb meal, sugary drink, or dessert. If left untreated, these vision problems can worsen over time, and you may start to see dark, floating spots or streaks in your field of vision. The good news is that this type of vision impairment can be resolved once blood sugar is brought under control and stabilized, though it may take 3 to 6 months for the eye to fully recover swollen or bleeding gums. Gum disease is a common complication of diabetes that can also make the condition harder to control. This is because the body's response to infection, such as gum disease, is to release more glucose into the bloodstream, swollen or bleeding gums. If you have diabetes, your saliva contains higher levels of glucose, providing more fuel for the bacteria that combine with food to form plaque and cause gum disease. Symptoms can start with red or inflamed gums, but if left untreated, they can progress to periodontitis. This condition can cause the gums to pull away from the teeth, the appearance of pus or ulcers, and even tooth loss. To prevent this damage to your gums and teeth, it's crucial to control your blood sugar levels and see a dental professional for preventive care and treatment of any gum issues that arise, blisters, dry skin, or other skin changes. When your blood sugar levels are not well controlled, you may notice the development of small skin tags in the folds and creases of your body, especially if you're trying to manage your weight. Another common sign is the appearance of dark, thick patches of soft skin, known as acanthosis nigricans, which often form on the neck, hands, armpits, or face. This can indicate insulin resistance. Other potential diabetes-related skin issues include dry and itchy skin, painless blisters, thick and stiff patches of skin, yellow bump-like growths, and large, painful sores, hearing loss. Fluctuating blood sugar levels can significantly increase the risk of hearing loss, as diabetes impacts the inner ear in multiple ways. Long-term high blood sugar can damage the small blood vessels and nerves, impairing the inner ear's ability to properly transmit sound signals to the brain. Conversely, prolonged low blood sugar can also disrupt how the inner ear sends nerve signals. This explains why individuals with diabetes are about twice as likely to experience hearing loss compared to those without the condition. Fruity smelling breath. Fruity breath is a common symptom of diabetic ketoacidosis, DKA, a serious diabetes complication. This occurs when your body lacks sufficient insulin to move glucose into your cells, causing your liver to break down fat for energy instead. This fat breakdown process releases ketones, which are acids that increase the acidity of your blood, creating a life-threatening condition if left untreated. One of these ketones, acetone, is responsible for the distinctive fruity odor in the breath of people experiencing DKA when to see a doctor. All of the symptoms we have discussed can be attributed to other health issues as well, so there's no need to panic if you experience things like fatigue, irritability, or increased thirst for a short period of time. The same goes for any of the other potential diabetes warning signs. However, if these symptoms become persistent and are accompanied by other diabetes red flags, it's time to get checked out by your doctor. Your doctor will run blood tests to assess your A1C levels, which provide a snapshot of your blood sugar stability over the previous 3 months. They may also do a fasting glucose test. Requesting an insulin level test is also advisable, as insulin levels often start rising long before blood sugar becomes elevated, reversing type 2 diabetes and prediabetes. To reverse type 2 diabetes and prediabetes, making the right dietary and lifestyle changes is critical. A diet rich in antioxidants, organic vegetables and fruits, and naturally raised meats, poultry, and fish, combined with certain targeted natural supplements, can help stop the progression of diabetes and reduce the damage it does to your body. If you are struggling with type 2 diabetes or have been told you are pre-diabetic, then you'll definitely want to check out this supplement at the link below. It contains 5 key nutrients that help you maintain healthy blood sugar levels. If you enjoyed this video, like, share, and subscribe, and click on notifications so you never miss a video. Unlock your best health today, ready to take your wellness to the next level. Our all-in-one supplement is packed with essential nutrients like vitamin K2, magnesium, pomegranate, beets, vitamin C, and L-citrulline, designed to improve blood flow and support your overall health. Click the link below to discover more and start your journey to better health now. Don't forget to like this video, share it with friends and family, and subscribe to our channel. Hit the notification bell so you never miss our latest health tips and updates. Let's thrive together.